Okay, in Fox 5 Health News, cooling towers are the focus of the investigation into the city's Legionnaire's outbreak, but a government report shows most deaths from Legionnaire's are tied to hospital and nursing home showers.
Joining us now is Dr. Devi Parampo.
You did it perfectly.
No, I'm tired today. NYU School of Medicine. So good to see you today.
Nice to see you again.
This is kind of an interesting sort of switch. What's your take on this?
Well, this data is actually from 2011 and 2012. So when we think about the outbreak now, we can see signs that there was going to be a problem even years ago. It's been growing over time. I mean, this particular outbreak has to do with the cooling towers. The report shows that a lot of our drinking water actually has been contaminated in the past. And so when you think about nursing homes or hospitals having this in their plumbing system, I mean, these are the people who are most vulnerable to getting ill or dying.
Right, and it's often underreported because it's difficult to trace it back that was the problem.
Sure, exactly. And then on top of that, the thing is, Legionnaire's is not something that we think about automatically when we see pneumonia. So for a lot of people, I think we're underestimating the number of cases. If somebody's healthy who comes down with a cold or a cough or these types of symptoms, they may not get tested for Legionnaire's, right? So they might recover. And then at the same time, you have people who are very sick, let's say with cancer, so their immune system is compromised. Maybe they have lung disease and then they get Legionnaire's. They may not get tested either because people assume that it's the other disease that...
Right, so ultimately, what's sort of the takeaway from this information and what we've seen happen here?
Well, I think we need to do more in terms of regulating the plumbing. Right now, there are not many regulations in terms of looking at this type of stuff. So for people at home, they can't clean the plumbing system. Like, you can't clean your vents and say that you're protected from this. It actually has to be something that's done with the water safety. Or otherwise, if our government feels like the cost-benefit is not... in its favor, we need to do more.
That would cost a lot of money,
right? We need to do more than at least to respond immediately when patients start getting sick.
Yeah, this has been really some outbreak, very educational. Well, hopefully more of those cooling towers will be cleaned and we'll be in a better spot. Okay. All right, let's switch topics now. New York State has banned the sale of powdered alcohol. It's also known as palcohol. Governor Cuomo signed legislation today, and he says that this particular powder is dangerous to public health, and it's a disaster waiting to happen. Which it really could be, particularly if it gets in the hands of young people.
Of course, so that's his argument, that essentially if young people get their hands on this, it's very hard to regulate. We're not really prepared to kind of manage this powder. So essentially what it is powder that you can pour into anything, whether it's fruit juice, water. You could actually pour it on food if you wanted to, let's say as kids, or they could snort it. So we don't really have plans in place to try to manage that kind of, let's say, alcohol poisoning. But on the, just to play the devil's advocate a little bit here, for people that already sort of drink socially, right? The powdered alcohol might be something that is convenient for them, that they don't have to carry heavy liquids and stuff. And the company might make the argument that...
The sales pitch was when you're going camping, you don't have to lug those bottles up the mountain. You just bring a little powdered alcohol, you're good to go.
You got your bottled water or whatever.
Right. Yeah.
And their argument is that if it was made legal or allowed, that actually we could have regulations, whereas this way it still exists. So for kids, if they want to get their hands on it, nobody would know exactly what's going on.
This was sort of a fascinating whole thing because, I never even contemplated the idea of powdered alcohol. Next thing you know, it's available, and the states are trying to catch up. I feel like that whole thing moved very quickly.
It did. So the federal government's allowing it. That's why it's out here. But at the same time, the states are the ones that are kind of opposing it. And New York is not the only one. There are about 20 others that opposed it. So I think it's going to be tricky for people to kind of navigate what to do with this.
Definitely. No, right. Not much upside for politicians on that one. Keeping it legal, then something happens. Why don't you do more? The whole thing.
Sure.
All right, Dr. Devi, we appreciate it. Thank you very much.
Dr. Devi Parampo.
That's perfect.
Very nice.
I redeemed myself.
That was good. It really wasn't that bad the first time around. I'm telling you, you're beating yourself up.
I have about getting names right. It's my little tick.
Good.
All right, it's Friday. You'll forgive me.
All right.
Thank you.
Audrey, 85 out right now, it looks like, right?
It is warm out there.